this is the way of international bureaucracies. They never let a good crisis go to waste. They're not very accountable, as you know. You and I don't vote for the Director General of the World Health Organization or any other members of it. I think we shouldn't get carried away. There's no way our government, or the American government particularly, is going to allow the international law to impose lockdowns from the WHO on us in the future. We'll still have to do it through our own governments. But there will be pressure to go down that route. And you'd think that if there was a discussion of a pandemic pact or pandemic treaty from here on, it should include things like, can we be transparent about what kind of gain-of-function research on viruses is happening inside countries? Because that may well have been how this one started, and if it isn't, it may well be how the next one started, because research has been going on dangerous viruses. That's not even on the agenda, because that would offend China, which is, as you know, very influential in the World Health Organization. So the World Health Organization is talking about lockdowns, social distancing, vaccine mandates, and all those kinds of things as reactions that we must all adopt in response to the next pandemic. Now, some of those are fine. I'm all in favour of vaccines, and I'm in favour of some kind of pressure on people to take vaccines, because otherwise you get into trouble. But I'm not in favour of these lockdowns. I think that they may work to eradicate a virus in the very first few weeks or months, but after that, as we showed, they were useless. All they did was destroy the economy, disturb people's lives, cause mental illness, and so on. And the evidence suggests that is not what we should be doing. We should be getting people to voluntarily distance themselves if there's a pandemic in the future, but not forcing them to.
Well, what I don't get about that, Matt, is that a public health bureaucracy, supposedly, gets to determine whether they will tank the economy. I mean, if anyone's going to tank the economy, I'd rather it were the, G7 finance ministers or whatever. They seem more relevant to the question of who gets to tank the economy. Whereas the one thing that the WHO is supposed to do, just to go back to your book, you shouldn't have had to write that book, because the WHO would have been upfront and transparent about the origins of this virus, and the government of China would have admitted the WHO team in there to prowl around before everything got destroyed. So your book, in effect, results from the failure of the WHO.
The WHO has a poor track record in recent years. It admitted that it got the Ebola outbreak in 2014-15 badly wrong. It actually looked into that and said, look, we made a lot of mistakes. They were basically being too political and not scientific enough in that case. It said in 2015 that the major threat to human health in the 21st century is climate change. So that suggests that it wasn't really focused on the day job, which is not climate change. And it then, in this case, gave tremendous support for China in the first few weeks, saying they were being transparent. Words could not describe their admiration for the Chinese measures, and that China was right that there was no human-to-human transmission. They said that right up until the middle of January 2020. They then mounted an origins investigation, which took the best part of a year to get going,